Good afternoon. Welcome to Tuesday Reading Live Session. This is me, Vandana PS, joining you from 𝐻𝐿𝐲 Academy. How are you all? How's your Tuesday going? Okay, is it all good? So in today's video, we will be dealing with Part A in detail. Okay? So may I know any freshers or any new students attending this live session? Okay. So a new day, again we have another new topic. So that is prostatitis. Okay. So let's directly move to the topic. I'll show you the topic on the screen, then we will discuss. Okay. So this is the topic. So what do you know about Part A? Okay, so we can take this session as a revision. So please comment, what do you know about Part A? Let's start with the timing. Then I will discuss you regarding the number of questions. Then let's talk about the strategy. Then we will move to the material. All right. Okay, Reba, Grishma, good afternoon. Yes. Okay. So about Part A, that I can say, this particular module, this exam, we can say it is almost 1 hour exam. So within this 1 hour, you can complete Part A within 15 minutes. So the remaining time that we have to spend for the completion of Part B and C. Okay. So in this video, we'll be dealing with how can we complete Part A within 8 minutes. Okay. So what strategy that we are using, what method that we can apply here to complete this particular part within this stipulated period of time. Okay. Okay. Okay, we know Dadra, Abhi, yes, Alina, Nebi, good afternoon. How are you all? Okay. Then, yes, tell me. So what do you know about Part A? It's only about 15 minutes. So today we are going to deal with how to complete Part A within 8 minutes, the step-by-step procedure. Then, what is the strategy? What strategy that we can use to complete Part A? Any idea about the strategy? Which strategy that we can use? So the method is all about skimming and scanning. Okay, you have heard a lot of times regarding skimming and scanning, I know that. But still, this is like a revision. So we are hearing or we are listening to the same word again and again and again. So it means that it's like thoroughing all these things, understanding everything, comprehend everything, right? Okay, so yes, tell me what is skimming and scanning? Hi Zino, good afternoon. Yes, what is skimming and scanning? So skimming, the word which means fast or speed reading. Okay, whereas scanning, which means we are picking some important words from the text. So as you know, we have 4 texts: text A, text B, text C and text D. So from this 4 texts, we are picking out some important words. Okay, if you are just skimming, you will not understand anything, any single word, because skimming, which means fast reading. Okay, so there is no connection with cognitive process in skimming. So it is very important to make a connection with cognitive or thinking related, or that idea should be there, that concept is there. Okay, so for that we need scanning. Clear? So yes, we are applying skimming and scanning method here. So to do skim and scan or to apply this technique, we need to underline, as I already mentioned, some keywords from each of the text. Okay, so what are the keywords? How you know that these are the important words? Okay, so we have a certain order of keywords. I'll tell you, and you guys already know that. So first one is, we can mark all the headings. Okay, it is very important to mark all the headings. So can you tell me what is the second one from the order? What is the second one? Okay, Reba, skimming and scanning method, 20 minutes 20 questions, 15 minutes, okay. Okay, Biji, skimming and scanning. Then Ramya, yes, skimming and scanning. Reba, quick research, okay. Okay, quick search. Fast reading. Okay, Yogeshwari, yes. Where were you yesterday? Okay, so yes, that is the second one. You can mark all the subheading. Okay, subheading. Mark all the subheadings. Yes, very good, Biji. Yes, subheading. So first one is headings. Second one, all the subheading. Yes, Jinu, very good. Third one, we can mark all the numbers. Okay, when I say numbers, yes, all the numbers you can mark. Maybe sometimes they will mention these numbers in the form of words also. For example, TWO. That is a number actually, but it is in letters, 2. Okay, so likewise we can mark all the numbers from each of the text. Okay, then the next important thing is, what is the next one, fourth one? After numbers, what else is there? Very good. Okay, Reshma, it is all the names. Okay, we can say proper nouns, all the names. Maybe name of a person, name of a disease condition, name of a particular medication, name of a place. Okay, so whatever mentioned in names, we can mark all the names. Okay, so one thing you have missed. So what is that? Actually, names, yes, of course names are there, but before names there is something else. What is the fourth one? Actually, names, which comes fifth. So before names there is something else. So what is that? Very good, Biji. Yes, signs and symbols. Okay, you guys know that, signs and symbols. So all the headings, subheadings, numbers, signs and symbols. So when I say signs and symbols, you know, you can mark all the signs. For example, equal to is a sign, less than is a sign, greater than is a sign, percentage is a symbol. Okay, so likewise we can mark all the signs and symbols from each and every paragraphs. Then fifth one, okay, already you told me that it is all the names. Okay, sixth one, which I can say abbreviations, okay, or short forms. Sixth one, yes, Fasila, signs and symptoms, okay. Very good, Adra, abbreviations, short forms. Okay, so what about the next one? Seventh one. What about seventh one? Yes. Okay, Reshma, abbreviations. Yes, Reba, abbreviations. Okay, what about seventh? Seventh one. Any idea? What will be the seventh one? Okay, so when you read, when you skim and scan, you can catch or you can see certain italicized or bold words. Okay, italicized or bold words. Actually, you don't have to mark it, but still, when you categorize those important words, we can include this italicized or bold words into it. Okay, and what about the next one? Okay, eighth one. After italicized and bold words, eighth one, all the brackets. Okay, all those things which is in brackets, we can mark. It is very important. And ninth one, okay, it's all about certain type of words. I can say the words that indicate time. Okay, the words that indicate time. So what are the words that you know which indicate time? Can you please comment? What are the words that you know which indicate or you can associate with time? Okay, yes, Reba, word indicates time. So tell me, what are the words that indicate time? What are the words that indicate time? Now, okay, till, very good, then what else? Okay, so now, till, early is a word that indicates time. Delay is a word that indicates time. After, before, okay, currently, presently, previously. So when, yes, of course, presently, frequently. So these are all the words which indicate time. So it is very important. It will help you. Okay, during is another word that indicates time. And the 10th important keyword which I can say, it's all about, you can mark the words that can be related with experiments. Okay, so what are the words that can be related with experiments? Okay, we know the presently. Very good, very good. Okay, so what are the words? 10th one is all about the words which indicate experiments. So what are the words that can be related with experiments? Any idea? Diagnosis is a word that can be related with experiment. Test is a word that can relate with experiment. Identification is a word that can relate with experiment. Ascertain is another word that can be associated with experiment. Okay, so likewise we can mark all the words that can relate with experiments. And 11th one is all about marking the words that can connect with research topics. The word itself, research, researcher, okay, population, study, approach, okay, then observation. So likewise you can mark all the words that can associate with the term research. Okay, and the very next thing, 12th one is all about, I'm not asking you or I'm not saying you to mark all these. Okay, for example, the 12th one is all about marking all the first and last line of each and every paragraphs. So when I say this, you don't have to mark everything. Okay, I mean you don't have to mark the first line, last line of each and every paragraph. Instead of that, you can give special focus. Okay, just read it carefully what is in first and last line of the paragraphs. Okay, as well as give special focus to all the bullet points. Clear? I hope it is clear. Right? Okay. So that is all about the strategy. So do skimming and scanning plus apply this thing. Okay, you can mark the important words from each of the texts. And each text will be different from one another. For example, text A will be, maybe for example I can say text A will be based on a particular disease condition. Okay, so text A contains what is the definition of that particular disease condition. What are the symptoms? About the prevalence, the spreading. Okay, how many people are get affected? So these kind of informations will be there. I'm not sure. Okay, not always all the time, but 95% I can say text A will be of a particular disease condition, definition, symptoms, etc. When you come to text B, it's all about what? It's identification process or the procedure of identification. Okay, maybe what are the medicines used for this particular disease condition. And one text will be definitely regarding a pictorial of something. Maybe a chart will be there, or a table, or a diagram, something, or a statistics or something. Okay, so a pictorial will be there. Okay, and when you come to text D, maybe it's all about the outcome. Okay, the result, the treatment options. Okay, so likewise, if you are doing additional materials every day, you will understand their pattern. Okay, so hope it is clear. So now let's read these 4 texts and we can underline what are the important words from each of the text. Okay, so text A, prostatitis is inflammation. So prostatitis is the first keyword which I am marking, because that is the name of the condition. Prostatitis is inflammation of your prostate glands, name of the gland. Your prostate gland sits below your bladder, in front of your rectum. Your urethra, that means the tube that carries pee and semen out of your body, runs through the center of your prostate. If you have one of 4 types of prostatitis, the tissue in and around your prostate gland becomes swollen, tender and irritated. Urinary tract infection, so I'm just marking all these 3 words as well as the abbreviation, because it is bracket in brackets plus abbreviation. And other bacterial infections can cause certain types of prostatitis, but some have no cause. Then there are treatments that help manage your symptoms. More than 2 million, so I'm just marking 2 million people, AMAB, another abbreviation. See a healthcare provider, name of a particular specialist, okay, healthcare provider, every year, the time, that particular time, every year. For prostatitis symptoms, up to 50%, so again, there is a number plus symbol. Of all people, AMAB will have symptoms of prostatitis at some point in their lives. It's the most common urinary tract issue in people AMAB under 50. So again, I'm marking another number. And the third, see, THIRD, third, most common in people AMAB over 50. So these are my important keywords from text A. So can you tell me what are your keywords from text A? May I know? So may I know what are your keywords from text A? Is that the same? So what are your keywords? Okay, so I think let's move to text B. So what about text B? As I already mentioned, text A was all about that particular disease condition, that in its description, the explanation, definition, then the prevalence. Okay, when you come to text B, it's all about diagnosis. So yes, that is the heading, diagnosis. And to identify this particular condition, what are the procedures? So then they have mentioned a lot of procedures here. Digital rectal exam. So your provider inserts a gloved, lubricated finger into your rectum to check prostate gland for pain and swelling. This exam may include prostate massage to collect a sample of seminal fluid. Then urine analysis, that is the second procedure. Then blood test, then more invasive tests is there. Then cystoscopy as well as transrectal ultrasound. Okay, so these are the procedures. And now we are moving to text C. It's all about the signs and symptoms. People with non-bacterial prostatitis may not have any symptoms. Other 3 types of prostatitis share symptoms such as these are the symptoms. Okay, a lot of symptoms mentioned. Then text D, it's all about treatment. So what is important in this particular table? They have mentioned a table here. So category mentioned, empiric regimen mentioned, which means the routine mentioned, considerations. It's all about treatment regimens for ABP and CBP. So what is ABP and CBP? ABP, which means, okay, ABP, which means, okay, so that means acute bacterial prostatitis, and CBP, which means chronic bacterial prostatitis. So those are the synonyms. So yes, category, considerations, empiric regimen, yeah. So that's all about that. And a lot of numbers mentioned here. So you can mark all the numbers. Okay, the symbols as well, yes, every numbers. Okay. So that's all about marking the keywords from each of the paragraph. Okay, so now we are moving to the first question. Okay, so before that, let me remind you something. While you attend the sessions, okay, attend the live session, maybe you will get a lot of messages from fraudulent people. Okay, they will comment you near to your comment. Okay, maybe they will like your messages and comment you, they will text you. So don't reply to these fraudulent people. Okay, if you have any doubts or any concerns regarding the sessions or our classes, you can contact us on this number mentioned on the screen. Okay, so yes, now we are moving to the set of questions. So within this 15 minutes, we have to complete 20 questions. Okay, and this 20 questions can be categorized into 3 types. So 1 to 7, which can be called what? Match the following questions. And 8 to 14, which are called what? Short answer questions. Rest of the questions, 15 to 20, that can be called fill in the blanks questions. Clear? So that's all about the set of questions. Then what is the important instruction? So when you read a particular question, just understand what is the importance of doing it. Okay, or what is meant by each of the questions. So here, what is instruction? For each question 1 to 7, decide which texts. Okay, for the beginners or for the freshers, definitely they have some confusions regarding whether we have to answer to these questions. Yes, of course you have to answer, but not the exact answers. Just locate your answer and find out in which text that particular answer lies. So no need to write that exact answer. Instead of that, you can write the letters, whether it is in A, B, C or D. Clear? Okay, so first question. A method used to assess problems associated with urinary tract rather than prostatitis. So my keywords: method, assess, associated. So what is the correct answer? So for the question, first question, methods. So what is the method? The method which is mentioned in text B, diagnosis. Okay, for the identification we have a lot of methods here, so which is mentioned in text B. So what is another thing? A method that is used to assess, identify problems associated with urinary tract rather than prostatitis. So what is the method related to urinary tract infection? So that is urine analysis. A urine analysis and urine culture check for bacteria and UTIs. Okay, so answer is from text B. Okay, then what about the second question? The components, the factors, the parts, okay, that can engender prostatitis. So where is it mentioned? The components that can engender prostatitis. So which is mentioned in text A, as you can see here. If you have one or four types of prostatitis, the components types, okay, the tissue in and around your prostate gland becomes swollen, tender and irritated. So what you have to do? You can do urinary tract infections. It's not we are doing, okay, it's the problem of the condition they have mentioned. Urinary tract infections or UTIs and other bacterial infections can cause certain types of prostatitis, but some have no cause. Okay, so which is from text A. So that is from text A. Then next one, third one, the administration pathways, the management pathways. Okay, so where is it mentioned, the management, the treatment? So directly, which is from text D, as you can see here, it's all about the treatment. Okay, what are the management plans? A lot of medications mentioned here. So that answer should be from text D. Then people belong to which age, okay, are more susceptible, weak to prostatitis? So what is the answer? People belong to which age group? So the prevalence which is mentioned in text A, as you can see here, the last paragraph, the last line. See, common urinary tract issue in people AM/AB under 50. And the third most common in people AM/AB over 50. Sorry. Okay, so that is from text A. Fifth one, the progressive kind of approaches to validate prostatitis. What is the progressive kind of approach? What is the advanced kind of approach? So that we can say the approaches or that procedures, the methods which is mentioned in text B. Okay, so what are the techniques? What are the progressive or what are the advanced procedures? See, more invasive tests. What are they? Cystoscopy as well as transrectal ultrasound. So these are the more advanced approaches or methods. So that answer is from text B. Then sixth one, the duration it needs to take medication for chronic bacterial prostatitis. So duration, which means how long it will take. Okay, medication for chronic bacterial prostatitis, which means CBP, and that is mentioned in text D, the medication, the treatment as well as acute plus chronic. That is from text D. And the final one, the sort of prostatitis, the type of, okay, exhibits, displays no evidence on symptoms. So which is mentioned in text C, symptoms, signs and symptoms. People, the first point, people with non-bacterial prostatitis may not have any symptoms. So that answer is from text C. Okay, so clear? Then we are moving to the next set of question. Answer each of the questions 8 to 14 with a word or a short phrase. short phrase, which means, as you know, maximum 3 words, not more than that. From one of the text, each answer may include words, numbers, or both. So the first question, the condition that is no longer treated with fluoroquinolones. So what is the condition? Name of a particular condition. So what is the name of the condition? Which is mentioned in text D. Okay, treatment. So that is from text D. So yes, what is the condition called? Okay, see this particular second box. Okay, second one. Fluoroquinolones is no longer used for gonococcal infection. So we are not using this particular thing for this particular infection, gonococcal infection. So answer should be gonococcal from text D. Okay, then 9th one. Okay, you got 7 out of 7. Very good, Abhi. Okay. 9th one, diverting to. We are switching to which route, which procedure, okay, is ideal if the blood culture is negative or abscess drained. Switching to a particular procedure. So what is the procedure? 9th one. So what is the procedure mentioned? Okay, Banu, is that IV switch or oral? Okay, switching to which procedure? Again, it is a treatment method. So as you can see here from text D, okay, IV switch to, so which we are switching to or diverting to dash, which procedure? Oral. So answer should be oral. When blood culture negative or abscess drained. So those are the keywords, see. So answer should be oral. Okay, yes, Tessie, very good, oral. Adira, yes, oral, yes. Okay, Abhi, yes. Okay, Rosemary, yes, oral. Okay, so the 10th one. Okay, yeah, 10th one. Name. So we need a name of something. What? The name of the instrument. Then name the instrument constitutes a pencil-sized lighted tube with a camera or reviewing lens on the end to review inside the bladder and urethra to detect urinary tract problems. So what instrument we are using to identify these things? So which instrument? Name the instrument. So the methods, it is from text B. So as you can see here, okay, as you can see here, we are using which instrument? So see, these are the keywords from the question. What are the keywords? Pencil-sized lighted tube with camera and lens. Okay, so what we are using, what instrument is mentioned here? Your provider uses a cystoscope. Answer should be cystoscope. What instrument? Cystoscope should be the answer from cystoscopy, which is mentioned in text B. Okay, so answer is cystoscope. Okay, then next one, 11th one. The category of prostatitis exhibits the symptoms related to that of flu. What is the category? Category of prostatitis exhibits, displays the symptoms related to that of flu. So which is related to signs and symptoms, right? So which category? It is the last one. Yes, ABP. So even if you can write ABP or you can write acute bacterial prostatitis. Yes, both are correct. Okay, which is from text C. Acute bacterial prostatitis cause flu-like symptoms. So this is the keyword, flu-like symptom. Okay, so answer is acute bacterial prostatitis. Okay, so the next one, a lot of correct answers, right? Jishnu, ABP, okay. Tessie, Lakshmi, okay. Honey, Reba, okay. Yes, okay, Abhi, ABP. Biji, okay, very good, very good. Okay, a lot of correct answers, right? Yeah. 12th one, name. Again, we need the name of something. Name the state that can be expounded as the appearance of blood and semen which spots symptoms of prostatitis, which indicate or which sport the symptoms of prostatitis. What is the name? Okay. Okay, so which is mentioned in, again, signs and symptoms. See, that answer is keywords. What are the keywords? Blood in semen. So that answer should be hematospermia from text C. Okay, so don't write blood in semen. Answer should be hematospermia from text C. Okay, then the next one, the enhanced level of which protein? So we need that particular protein in the blood sample, ascertain, identify the existence of prostate cancer. Okay, so which is from text B. So which is mentioned here? See, it is all about the blood test from the question. A blood test measures PSA. So what is the name of the protein? PSA. A protein made by prostate gland. High levels may be, so enhanced levels, high levels may be indicate prostatitis, enlarged prostate or prostate cancer. So these are the keywords: protein, prostate cancer, high levels, prostate gland. So answer should be PSA. So that is the name of the protein. Okay, then the next one. 14, the last one, the tube, the name of the tube that carries pee and semen out of one's body. So what is the name of the tube? Which is very easy from text A. And the name of the tube, that is urethra. Okay, second line, your urethra, that is the tube that carries pee and semen out of your body. So those are the keywords. Okay, so that is urethra. Very good. Okay, Reba, Reshma got the correct answer. Very good, excellent dear. Lakshmi, okay, urethra, Banu, very good, excellent. Okay, yes, Tessie, it is urethra. Then, so that is the end of short answer questions. Okay, now we are moving to the rest of the questions, 15 to 20, fill in the blanks. So when you do fill in the blanks, same recommendations. Okay, same instruction. You can write it in a word or a short phrase. Maximum 3 words. Okay, and don't repeat the words. Okay, from the question. It is applicable for short answer question as well as in fill in the blanks. So people with acute bacterial prostatitis or ABP or chronic bacterial prostatitis CBP that does not improve with dash may get transrectal ultrasound. So what is the missing word here? People with ABP or CBP that does not improve with dash. So what is your answer? What is the answer? Any idea? Transrectal ultrasound. Is it correct, Banu? What is the missing word there? People with bacterial prostatitis or ABP or CBP that doesn't improve with dash. So there will not be any improvement if you are having this. What is that? So answer is from text B. Okay, so what is the answer? Transrectal ultrasound, that is a keyword from the question. People with acute bacterial prostatitis, another keyword. Chronic bacterial prostatitis, another keyword. That doesn't improve with antibiotics. So answer should be antibiotics. Okay, direct answer, right? So antibiotics should be the answer. Then 16th one. The 3 types of prostatitis share symptoms such as pain in your lower abdomen, genitals or dash. Okay, so answer should be from text C. So yes, what is the correct answer which is mentioned in text C? Okay, so pain in your lower abdomen, genitals or perineum. So answer should be perineum. Very good, from text C. Then 17th one. Prostatitis is the most common dash issue in people AMAB under 50, third most common in people AMAB over 50. So definitely the numbers which is from text A, the last paragraph. Okay, so what is the number? Or what is mentioned here? It is from text A. All the numbers mentioned here, the 50%, the number 50, then under 50. So that answer should be what? Okay, more than 2 million people, maybe, see a healthcare provider every year for prostatitis symptoms. Up to 50% of all people, so that is a keyword, will have symptoms of prostatitis at some point in their lives. It is the most common urinary tract issue in people with AMEB under 50, another keyword, and the third most, another keyword, in people AMEB over 50. So that answer should be urinary tracts, okay, which is from text A. Then 18th one, in dash, your provider inserts a gloved, lubricated finger into your rectum to check the prostate gland for pain and swelling. Again, that is from text A. Okay, so what is the answer? It's not from text A? Yeah. So what is the answer? It is from text B. Yes. The diagnosis, the first one. Okay, your provider inserts a gloved, lubricated finger for what? For doing digital rectal exam. So answer should be digital rectal exam. So that your provider inserts a gloved, lubricated finger into your rectum with your consent to check the prostate gland for pain and swelling. So these are the keywords. So answer should be digital rectal exam. Yes, very good. Digital rectal exam. Okay, yes. Then 19th one. Again, the duration, how long? Okay, of the medication, the ciprofloxacin or levofloxacin is 14 days that can be extended to dash weeks. So how much weeks? It can be extended. And that is from text D. The treatment options, of course, mentioned in text D. So where this medication is mentioned? Okay, so the medications mentioned here in the first box, ciprofloxacin, as well as levofloxacin, and that extension should be extend to 4 weeks. Okay, so 4 weeks should be the answer. Weeks is already mentioned, so answer is 4. So the last question, up to dash of all people, AMAB will have symptoms of prostatitis at some point in their lives. So up to dash, which means up to, what is the number? It is up to 50%. Okay, so that is from text A. Up to 50% of people, AMAB, that is a keyword, will have symptoms. Another keyword, prostatitis, another keyword. So answer should be 50%. So I think the last one, fill in the blanks, was very easy because it was direct answers. Okay, but 1 to 7 set of questions, it was a little bit tricky. Okay, match the following. Short answer as well as the filling the blanks was easy, right? Okay, Reba, you got 20 out of 20. Very good. Okay, Abhi, very good. 20 out of 20. Excellent. Okay. So now, that's all about the session. So let's wind up for today. Okay. As I already informed earlier, if you have any concerns or doubts or queries regarding the sessions, please contact the number mentioned here. Okay. So stay tuned. Let's meet tomorrow. Thank you all. Good day.